There are two common types of clicks. One is a problem and the other isn't. Let's start with the concerning one. Here's what your vet might not have mentioned during your pre-surgery consultation: the dreaded meniscal click. No matter which type of ACL surgery your dog had, there's a chance the meniscus can tear after surgery while your dog is in recovery mode. Post-op meniscal tears happen more frequently with lateral suture, TTA, MMP, and CBLO than they do with TPLO. But the truth is it can happen after any of the cranial cruciate ligament surgeries. Figuring out what these clicks are about means you need to know what a meniscus is. There are two crescent-shaped cartilages in your dog's knee called the medial and lateral meniscus. They're located on top of your dog's shin bone, the tibia. Among other jobs, they cushion the area between the thigh and shin bones. The usual troublemaker when it comes to post-op clicking knees is the medial meniscus. When your dog bends and straightens their knee, the torn bit gets trapped. That's the popping sound you're hearing. The problem is that with every pop, your dog feels pain, and that's why they're holding their leg up or limping. Meniscal tears usually require some form of surgical treatment. You're wondering, with rest and a little more time, can a meniscal tear heal on its own? Oftentimes they don't, because they don't have a major blood supply. Healing can be slow and limited. Your next question might be, how do I know if my dog's clicking knee is a meniscus tear and not something else? Okay, this next part is crucial. Look for red flags that suggest the meniscus is torn, like clicking that wasn't there before knee surgery, especially if your dog is reluctant to put weight on their leg. Figuring this out isn't easy, especially if they're still limping from their CCL surgery. Sometimes it seems like everything is going great with recovery. Your dog's healing is on track. They're weight-bearing a little more each day, and then out of the blue, the clicking and limping starts. No matter how it started, if clicking comes with behavioral changes, this is another red flag. This can look like less than usual enthusiasm for walks or seeing them struggle when changing from one position to another, like from lying down to standing up. And last, if you notice the popping sound happens with every step instead of occasionally, or if it's getting worse over time instead of better, this and any of the signs I previously mentioned are excellent reasons to call your vet for guidance. So what happens next? Well, knowing the options will help you feel prepared when you call your vet. Here's what they might recommend. The first is medical management. This could include things like continued rest and giving your dog prescription medications to ease pain and swelling. If they recommend surgery, there are two methods for finding and fixing a torn meniscus. And don't worry, the procedure itself costs much less than CCL surgery. And the good news is that recovery is quicker. The first is called open arthrotomy. Generally speaking, some vets say that arthrotomy can be more painful and take longer to heal than with a procedure called arthroscopy. Your vet can explain which they prefer or recommend for your furry best friend. Arthroscopy is an optimal way to find and fix meniscus tears in dogs. The equipment itself is expensive and requires advanced training, so most times board-certified veterinarians are the ones doing it. Incisions are very small and at the surface of the skin, so healing is faster with arthroscopy. There's actually some good news. Are some clicks normal and nothing to worry about? Yes. These kinds of clicks can be infrequent, frequent, or decreasing over time. The most important factor is that these clicks don't come with limping. Your dog is acting normal, same energy level, same enthusiasm, and the same comfort level when moving around or resting. These mechanical clicks often resolve as scar tissue forms and the joint mechanics stabilize. Now that you understand what's really happening with post-TPLO clicking in your pup's knee, here's where most dog owners mess this up completely. I see dog owners falling into two camps, and both are making a big mistake. Camp 1, they're ignoring all clicking completely because they want to stay positive. And I get it. You've been through so much stress already, and the last thing you want is another problem to worry about. But ignoring clicking entirely can prolong their recovery. Then there's Camp 2. They panic about every single sound or call the vet for every click. Allowing anxiety to take over is what makes people terrified that their dog's knee surgery failed or that they'll never see their dog running or playing again. But here's what anxiety can't do. It can't actually assess your dog's comfort level, healing pattern, or figure out the difference between mechanical clicking and pain-related clicking. It won't ever get you to that moment of relief when you confidently say, "I know my dog best. I can figure this out." So what I'm saying is that panic isn't helpful, but careful observation is. And that's what brings us to the game-changing 4-step plan that so many dog owners aren't even aware of. Call your vet with this info, and they'll be so impressed. Step 1. Document the clicking pattern. Note when it happens, how often, and what triggers it. Does the popping also come with new or worsening limping? Jot down daily notes about this stuff and what I'll mention in the next few steps. Step 2. Notice their willingness to bear weight. Watch them walk and compare it to how they moved before the clicking started. Notice how they sit, stand, and change from one position to another. Do they seem as happy and content as before? Step 3. Monitor progression for about a week. Are the clicks getting better, worse, or staying the same? Step 4. Based on what you see and hear, put in a quick call to your vet team for expert guidance. Look, I get it. The idea of another possible procedure and recovery sounds awful. But hang in there. Keeping a watchful eye, staying calm, and knowing when to call your vet will get your dog back on all four paws again. If this video helped, please like and comment. It tells YouTube that my videos are worth recommending to other dedicated dog owners just like you.